The Florida Department of Health is working around the clock to identify those who are most at risk of contracting COVID-19. We are prioritizing testing for any individual who is symptomatic, fever, cough, shortness of breath, and has traveled through an area of community spread. We encourage them to contact their medical provider. Please don't self-diagnose. Describe the symptoms that you are having, work with your provider, and if your provider feels that you meet the criteria for COVID-19 testing, they can coordinate through one of the commercial labs, LabCorp or Quest. There's a two-step process, which includes a specimen collection kit and then a test kit. The specimen collection kit includes the swabs and the sputum culture that are collected from the patient, which are then sent to the lab where the testing kit is housed. The testing kit includes reagents, which are basically chemicals that run the test to prove whether the person is positive or negative for COVID-19. We encourage social distancing because it is very easy to spread through droplet transmission, meaning if someone coughs or sneezes near you and you breathe that aerosolized matter in, you are now possibly infected with the virus. We want to isolate the sick for 14 days because that's typically the duration of this virus. At the end of the 14 days, if they are symptom-free, then they have the potential of testing negative for the virus. But they do have a clearance process for those individuals. For the latest information on the COVID-19 virus, we encourage everyone to visit the Florida Department of Health and the CDC websites.
The Florida Department of Health wants you to keep practicing social distancing. If you need fresh air and would like to do some outdoor exercise, that's okay. However, if you're around other people, keep 6 feet between you when possible. Avoid hugs, handshakes, large gatherings, and close quarters. If you have a cough, fever, shortness of breath, or sore throat, stay away from others even if they're in your same household. Doing your part will save lives. Please visit floridahealth.gov and the CDC websites to stay informed. The length of time that COVID-19 survives depends on factors. These factors include the type of material or body fluid containing the virus and various environmental conditions such as temperature or humidity. Researchers at the CDC and other institutions are designing standardized experiments to measure how long COVID-19 can survive in situations that simulate natural environmental conditions. So until more is known, clean often, especially high-touch surfaces. If you live alone and become sick during a COVID-19 outbreak, you may need help. Ask family, friends, and other healthcare providers to check on you during an outbreak. Stay in touch with family and friends with chronic medical conditions. Please visit floridahealth.gov and the CDC websites to stay informed.
The Florida Department of Health has teamed up with Hillsborough County government and other public health and safety.
Once the Florida Department of Health has confirmation that someone tests positive for COVID-19, we go over where they've gone and who they may have exposed while they were infectious. Then, we speak to the person and go over do's and don'ts. They are given a way to get in touch with us directly 24 hours a day, 7 days a week. When we check on the individual, we continue to remind them of do's and don'ts. Each situation is a little different. Some people live alone, some live with others, some may have to temporarily relocate to protect high-risk family members. We work with the individual, the immediate family if they have one, and community partners to ensure their needs are being met. The Florida Department of Health, along with its partnering health and safety agencies, is reminding residents to stay vigilant and help stop the spread of COVID-19. People with confirmed or suspected COVID-19 who do not need to be hospitalized, or those who were hospitalized and determined to be medically stable to go home should restrict activities outside their home except for getting medical care. Do not go to work or public areas. Avoid using public transportation, ride sharing, or taxis. Be sure to separate yourself from other people or animals inside your home. You should stay in a specific room and use a separate bathroom if available. Call ahead before visiting your doctor. If you have an appointment, call the healthcare provider and tell them your symptoms. This will help the office take steps to keep other people from getting infected or exposed. Household members and caregivers who have close contact with someone who has confirmed COVID-19 should stay at home and monitor their own health and call their healthcare provider right away if they start developing symptoms. We encourage residents to visit the Florida Department of Health and CDC websites for more on this topic. If someone is exposed and infected with COVID-19, the virus will not show up in a test until 2 to 14 days after the exposure. In the early stages of the infection, it is possible the virus will not be detected, which gives a false sense of security. That's why it's important to have a healthcare provider determine the best time for a COVID-19 test. Please visit floridahealth.gov and the CDC websites to stay informed. The Florida Department of Health understands that some of you may be concerned about your pets. The CDC has not received any reports of pets or other animals contracting COVID-19. However, it is always a good precaution to wash your hands after touching an animal. People with COVID-19 are asked to limit interaction with pets and other animals. Specifically, while they are symptomatic, they should maintain separation from pets as they would with any household members, and avoid direct contact with pets, including petting, snuggling, being kissed or licked, and sharing food. Please visit floridahealth.gov and the CDC websites to stay informed. The Florida Department of Health wants to stress the importance of speaking with your healthcare provider. It's a bad idea to self-diagnose and tell a healthcare provider, I have COVID-19, I need to get tested. A healthcare provider may not take you seriously if you do. If you have a fever, cough, or trouble breathing, call a healthcare provider and describe your symptoms. Your healthcare provider will then help you with your next steps. To be safe, you should avoid close contact with others, especially those in your household, until you know more. Please visit floridahealth.gov and the CDC websites to stay informed. This is a stressful time for everyone, including children. Provide your children with opportunities to talk about their feelings. Regardless of your child's age, he or she may feel upset and have other strong emotions. Encourage them to share their concerns and ask questions. The following websites have more information on this topic. You can also email DOH Hillsborough PIO at flhealth.gov. The length of time that COVID-19 survives depends on factors. These factors include the type of material or body fluid containing the virus and various environmental conditions such as temperature or humidity. Researchers at the CDC and other institutions are designing standardized experiments to measure how long COVID-19 can survive in situations that simulate natural environmental conditions. So until more is known, clean often, especially high-touch surfaces. Hi, my name is Kevin Watler, and I'm the Public Information Officer for the Florida Department of Health in Hillsborough County. Florida Department of Health has joined Nextdoor to share information and updates that have direct impact on your neighborhoods. Let me assure you that your Nextdoor neighborhood conversation remains private to you and your neighbors. We only will be able to see your replies and posts in private messages that you send directly to us. It's our plan to keep you informed. It's important to prepare your household for the coronavirus. COVID-19 cases continue to increase around the state. A coronavirus outbreak could last for a long time, and we recommend a 2-week supply of prescription and over-the-counter medications, food, and other essentials. Also, know how to get food delivered if possible. Having a household plan can help protect your health and the health of those you care about. The following websites have more information on this topic. You could also email dohhillsboroughpio@flhealth.gov. The Florida Department of Health wants you to protect your family and friends from COVID-19. We are all at risk of transmitting the coronavirus to someone who may not be able to recover if they get it. It's important to understand that people who are older and those with medical conditions such as blood disorders, chronic kidney or liver disease, have a compromised immune system, a current or recent pregnancy, heart disease, lung disease, or a neurological condition are at highest risk for a bad outcome. Please visit floridahealth.gov and the CDC websites to stay informed. It's important to protect yourself when you go shopping. Wash your hands before and after going to the store. Shop at off-peak hours so it's easier to keep a distance from others. If you're over the age of 60, see if stores in your neighborhood are offering shopping exclusively for seniors. Don't touch something at the store and then touch your face. Use a sanitizing wipe to disinfect the shopping cart or basket handle. Many stores provide wipes, but you might want to come with your own supply just in case they're out. A recent study shows young people can develop serious COVID-19 illness. A CDC study published on March 17th shows that younger people can develop serious COVID-19 illness requiring hospitalization. This finding is different from the first reports from China. That said, younger people are still much less likely to die from COVID-19 than older people. Each day we learn more and more. Please visit floridahealth.gov and the CDC websites to stay informed. The Florida Department of Health understands that some of you may be concerned about your pets.
Mr. Brewer.
EPG members, you are live in 3, 2, 1.
Good afternoon, everyone. I'd like to call the Hillsborough County Emergency Policy Group to order. Hope everyone had a great weekend and was able to get a little rest. So we'll now have the roll call. Clerk, please call the roll.
Miller?
Here.
Overman?
Here.
Merman?
Here.
Cronister?
Here.
Caster?
Here.
Ross?
Here.
Lott,
Here.
Snively,
Here.
Merrill.
Here.
All right, you have quorum.
Thank you very much. As you all know, at our last meeting, we decided to have public comment, and this meeting is the start of that. We have set aside 20 minutes for 20 minutes in total for public comment, and each speaker will have 2 minutes. Each speaker will have 2 minutes. So our first speaker is Mr. Gary Cloud. Mr. Cloud?
Yes, Mr. Chair. Can you hear me?
Yes, sir.
Yes, sir. Good afternoon, Mr. Chair and members of the Emergency Policy Group. My name is Gary Cloyd, and I wanted to thank you for your leadership during COVID-19. Since your last meeting, Mr. Chair and members of the EPG, there's been a huge increase in wearing of masks at your recommendation. One grocery store in South Tampa on Friday evening that I went into, I would say about 90% of the people were compliant with your order, or I should say strongly recommended in wearing masks. And the previous Friday in that same grocery store in South Tampa was about 25% compliant. I just want to pass it on because what you discussed on Thursday and what your communications group did, I think sent a good message and very compliant. I saw a big difference from one Friday to the next. It's amazing what you can accomplish once people are in that compliant mode, as difficult as the challenge is, and for people to understand. Thank you very much for your time.
Thank you very much, sir. Next speaker is Danny Kushmer. Danny Kushmer.
Good afternoon, and thank you. This is Danny Kushmer. Thank you for the opportunity to make these comments, and thank you all for your service. While Florida has been identified as one of the early states to begin reopening for business, I see how several governments around the state have either opened or are considering open beaches and other public land. This may be a good thing, but more importantly, these governments, including Hillsborough County, need to be placing a priority on opening up small business. We are seeing the negative impact on small business at a systematic level. This means distress, homelessness, sickness, and possibly even death for those who live paycheck to paycheck. Opening our economy is the humane thing to do. And as a small business owner myself, I want to encourage you to consider allowing businesses all over Hillsborough County the opportunity to open back up, providing they can adhere to the current CDC guidelines. Thank you all very much for your service, and have a great day.
Thank you, sir. Next speaker is Janet Nguyen.
Hello, can you hear me?
Yes, ma'am. Go ahead.
Hello, this is Janet Nguyen with the Tampa Bay Young Republicans. My first request is to make these meetings a little more transparent regarding notifying the public that they're happening. We're inundated with text messages about how to stay healthy during COVID-19 with hurricane information and other events. Information about these meetings, it would be great if they could be sent using the same text message system. And also if the agendas were a little bit easier to find. When I last looked, I couldn't find the agenda for this meeting online. My second comment, according to today's numbers, 19 people have died in Hillsborough County, which is 0.001% of Hillsborough County, and 0.0035% of people in the state have died of COVID-19. So God rest their souls. Every life is important. However, we now know that there is plenty of space in every hospital in Florida. We have access to plenty of ventilators, and anyone who gets sick can get help. At the same time, we've all seen the devastating toll that closing the businesses has taken on the economy. So if our objective was to keep everyone safe until we're to the point where we can help those who get sick, we have reached that point. I'm requesting you create a plan and act in a timely manner, allowing those who would like to get back to work and who are healthy enough and can follow the guidelines can do so. There are also many people with health issues other than COVID-19 who should be able to see a doctor today. While you may not feel we're ready to open the economy today, it would be great to create a plan and release it to the public so we can be prepared to get back to business as soon as possible. As you probably know, the president recently released a model, a three-phase plan that would be great to be used as a model. We would really appreciate that. Thank you.
Christopher Van Coolen.
Good afternoon, Commissioners. Let me start by saying I'm proud of how you all handled the rescindment of the curfew last week. I understand and appreciate your genuine concern for the safety of your constituents. You all seem to have a very good heart and really want to keep us safe. But in light of recent news and the relative stasis and decline of COVID infections in Hillsborough and Tampa Bay alike, we now need to put an eye towards a plan to return to normalcy. We've done our part as citizens to sacrifice our income, freedom, and sanity over the past 6 weeks to buy time so proper preparations can be made for emergency. And now we feel it's time to gradually return to a normal life and adjust course as necessary if needed. President Trump has unveiled a plan to do so, and Hillsborough County will be well served by its adoption immediately. If our ability to reopen is hindered by the governor's emergency order, we encourage you as commissioners to assert our county's handling of the situation to his office and respectfully ask that order be lifted in regions that have the threat under control like ours. Thank you for your time and thank you for your service.
Okay, we want to thank those that called in on the public comment. Appreciate it very much. The public comment is now closed. We're now moving to public health strategies. Dr. Holt, you recognize. Dr. Holt?
Hello?
Yes.
Sorry, can you hear me?
Yes, sir.
Sorry. Yes, I'm going to do a basic review of the virus, just reemphasizing and clarifying how it's spread. High-level review of some epi numbers, but Kevin Wagner will produce some more detail. And then do want to talk about some testing just to make sure we have some understanding of both what we have now and what's going to be on the horizon. The virus, COVID-19, has shown extraordinary levels of contagiousness, but the virus has continued to predominantly, the large number of infections result from prolonged and close contact. So for the majority of the time, it will be someone you know or have been around from a significant time. The blind spot, of course, is that anyone who feels fine can spread the virus. So ideally and recommended clearly is just be both situationally aware and informed, protecting your personal space, be extra cautious in groups, and reemphasize, be especially thoughtful around our vulnerable and our elderly. Our social distancing has slowed the spread. Our trajectory of new cases has slowed. It's plateaued, if you will. The caveat is our testing is also flat, and we need to also keep an eye on the regional data because people traveling across the county lines, whether they live, work, and play, means that the virus is continuing to be in our general area. Our medical surge, the hospitals are doing very well in the sense that the number of admissions are unchanged, but our concern of the long-term care and their surge capacity is concerning. We did have 20 cases that in 6 facilities, and there will be more. So let me talk about testing. And I took this information from a consultation with the local lab director. This information that I'm sharing is just what I know. It's not really making judgments. I think we're going to need all types of testing that's going to be coming, and based on the situation, which is the most useful. The PCR test that that is currently familiar with us determines, if positive, that someone is infected and therefore infectious. So we test the sick, and to do that, it requires the collector to be protected in personal protective equipment. The best time to obtain this sample is early in infection. As the illness progresses, it may have moved out of the nose and into the lung. Nasal swabs are still preferred and give the best results. Our lab results are coming back more timely LabCorp and Quest certainly have reduced their time, and we are blessed by local hospitals, Tampa General, Baycare, Event Health, and HCA all being able to do some here locally. So who are we testing? The symptomatic, with the highest priorities being healthcare workers, long-term care, hospitalized, or anyone with vulnerable risk for severe disease. There is the rapid test that's called Abbott, I think, is the common machine-based that I've heard about, read about. I'm not aware that they're here, and I certainly have not used them for any of our capabilities. It is a PCR test, so it's also best to test when someone's sick, and the earlier the better. Nose is still your best choice. It says the collection must be closely in proximity to the machine, as the collection has to be run within about 2 hours of once you collected it. And it runs sequentially, so it's one at a time, and that will define the number that you can throughput on that machine. Again, ideally, it's also should be used for symptomatic or ill in those sites that you can do what's called point of care or real-time testing with results. Finally, antibody test. It is my belief or opinion that detectable antibody in the form of what's called the IgG, this is the late antibody. It develops around 1 to 4 months, peaks at 4 months. But once this is developed, it is my opinion that it will be protective. It will protect those from getting reinfected, and even now is being sought after as a use of treatment for those that are actively ill. The amount of antibody developed or the strength of the response will vary by each person, so essentially for how strong and for how long. But for most, we should expect that it will be effective for about 2 years. The labs that are running these tests must identify the antibody that is very specific to this COVID-19 coronavirus, not one of the other coronaviruses that are cause of common colds. Just for reference, in the past season, it was a particularly heavy season for cold. We saw a number of coronavirus tests, non-COVID, that were coming in the winter and into the early fall or early spring, last few months. The ideal form of this test is quantifiable. You get a measurable amount. You can detect it in high, medium, and low, quantify it rather than the yes or no. This requires a draw from the arm and not the fingertip. Right now, that's a limited availability, but we do expect this to come both through LabCorp, Quest, and our local hospitals, and others will be developing their own. An example of this is Mayo and Rochester, which have developed a test for their patients and employees as needed. Who to test with this form is those the quantifiable is to confirm recovery. So you know someone who was infected has now fully recovered and has immunity. This will be beneficial in return to work settings and donation of plasma. It should not be used if somebody's ill, particularly early on, because you may be falsely negative. And it will also have value broadly when we want to look back and find out just how many people are actually infected and we never knew it and that weren't tested. A community serologic study. The qualitative test for the finger sticks that gives you a yes or no. Celex is the one that has gotten some degree of FDA acceptance. None of them have actually been formally approved, and there's many more on the market that I think has gotten a lot of media attention that were sold with no real FDA and validation, if you will. these have greater potential for cross-reactivity with those common colds, and therefore potential for false positives are higher. And I think, as Fred kept up with the media, that many countries have experienced problems with this test. So in conclusion, I just want to say that we do assume, and we must assume, that there will be a resurgence, but we just don't know when or how big. We'll talk more about that over the coming week. We're continuing to watch the case numbers for Hillsborough and Tampa Bay, along with the testing being done, emphasizing the personal responsibilities that we've all been emphasizing, focus on protecting our vulnerable, and I'll stop there.
Dr. Todd, thank you very much for that intense review. We appreciate it very, very much. Commissioner Overman has a question. Commissioner Overman, you recognize. Question.
Thank you, Chair. Thank you, Dr. Holt, for your report. That was a lot of information. I have just a couple of questions. If someone has a negative result, does the patient need to self-isolate for 14 days? And if their symptoms stay the same, worsen, or is there an opportunity to retest? That's the first question, and then I have a follow-up.
So I'm assuming that the person was ill, if you will, and came in and got a test, and it came back negative. And if an accurate, a well-collected sample through the nose, and that's probably the most key, is as long as that was done, a negative test shows that the illness is very unlikely, and I can't say 100%, not COVID-19. But the qualifications are the collection technique is probably the most important factor. And I'll tell you, as I mentioned earlier, the earlier the symptoms, the better. Beyond that, what to do if you're ill, I think you have to continue to do exactly what we're asking everyone else to do, stay even more certainly away from people while ill, and particularly the elderly. I'll stop there and hope I answered the question, but happily clarify if needed.
Thank you, sir. I also want to, oh, okay. Oh, wait.
Oh, you recognize, go ahead.
Sorry, thank you. And you may not be able to provide us with all of this information. It may need to be a combination of Dr. Holt, your team, as well as our EOC team. But in the coronavirus pandemic whole of America response that was sent out on Saturday regarding the president's direction for possibly, opening back our economy, there are 6 metrics that have to demonstrate a downward trajectory over a 14-day period and a robust system for testing healthcare workers before they can proceed to a phased opening. I'm not sure I'm seeing it in our incident reports, but are we prepared to report on a weekly basis at least our progress towards meeting those 6 metrics that are described in the President's report under guidelines for opening America again?
I'll comment, but I'll certainly defer also to Mr. Merrill and others. We begin that actual discussion to make that a standard part of this group reports, particularly in concert with the information that's available through additional modelings and other types of data that is important. So I believe, I can't say it's going to be aimed, that my understanding was we were shooting for Thursday, but I don't want to make a commitment without Mr. Merrill's directive. I'll stop there.
Mayor Ross, you recognize.
Thank you, Commissioner. Good afternoon, Dr. Holt. Could you tell us how many people are currently hospitalized and what what's the trajectory of new cases?
Yes, sir. I apologize. I had it right in front of me. I had reported that every day. I currently have, I apologize, 42 hospitalized. That is flat. As I was indicating, we have about 42 currently people as reported by the hospitals. We're dependent on the hospitals to report to us the number of admissions, but as of this morning, 42, and that's essentially unchanged from the report I gave on Thursday. I'll stop there.
Thank you.
Commissioner Merrill, you recognize. Commissioner Merrill, you recognize.
Mute. Dr. Holt, I wanted to ask real quick, are we going to get the charts like we did last week from Kevin Wagner at least weekly, or so that we can see the trends of hospitalizations and cases and deaths and all that?
I apologize. I should have made that transition after my ending and had Kevin. He is going to repeat. I meant to include him in mine and then open it up to questions. Yes, ma'am. Absolutely.
Thank you. So he's going to give a report today, right?
Yes.
Okay, thanks.
Merrill Lott, you recognize.
Thank you, Mr. Chairman. Dr. Holt, just one quick question. Of the 42 hospitalized, how many are in ICU?
Yes, sir. According to the numbers that were reported, 18.
Thank you, sir.
Dr. Holt, I'm sorry, Ms. Dudley, you recognize.
Thank you, Mr. Chair. Out of those 18, what are the ages of those that are in the intensive care unit, or could you tell us the ages of all the age range of the 42 and what ages are in ICU?
Yeah, the hospitals do not report that information to me. We are, over the last week, I'm trying to develop some information or connection, but I do not have that data and information, and as far as I know, it's not available.
Dr. Holt, let me ask you a question. Maybe you can answer it. Maybe, I don't know if Mr. Dudley is going to answer it during his presentation. How many people in Hillsborough County have been tested thus far?
Actually, Kevin, I think Mr. Wagner will also include that in one of his reports in his graphics. So I think that question will be answered here shortly. Okay.
Let me ask you another question. Do we have sufficient enough test kits in the county and PPEs?
Again, that one I might defer to. There's two issues. There's two sources of testing. There is the public testing that Mr. Dudley and we have cooperated with in the hospitals. We're trying to roll that out in other local communities. We have enough, is my understanding, yes, sir, both equipment and PPE to meet the current demand. I'd like to see more demand, but that's what we have. The hospitals, from what I know on a personal level with some of our community physicians and the lab directors, also have enough right now for the demand that they currently have, and I think are also looking in more ways to do more testing in a variety in different options. So I think the answer right now is yes, based on the demand, which we're hoping to stimulate. I'll stop there.
Okay. Thank you, sir. I'm now to call on Mr. Dudley for collection and testing side update. Mr. Dudley, you recognize.
Sir, could I ask Mr. Wagner to present if he's ready?
I'm sorry. Yes, go ahead. I'm sorry.
Because I left him out.
Sorry, go ahead.
Thank you. Well, Mr. Chair, can you see my screen?
Yes, sir, we can.
Great,
yes.
Thank you. Great. Again, my name is Kevin Wagner, the business analyst for healthcare services. I gave a presentation last Thursday. Over the weekend, the other analyst and I in the department, Ms. Emily Brooks, added some demographic information that should give a little bit more detail through the testing that's occurred in the positive cases of COVID-19. To date, on the Sunday update at 5 o'clock on the far right-hand side, there's been 960 positive cases of COVID-19 within the county. And again, that's on the return results from the lab of positive cases. So 960, which was a 2% increase over the Saturday on 4/18 of 943. And again, as we've said before, the labs are returning the results in a more quicker time that we're starting to see. So you'll see variability a little bit on the next slide. But Hillsborough County currently has about 63 positive cases per 100,000 population of the known results that have been returned. Again, 63 positive cases per 100,000 citizens of known results. The next line graph, we are starting to see the variability, as Dr. Holt mentioned before, that the labs will return a large number one day, a little bit less the next day, and a large number again. So that is what we're seeing, 5 of the last 8 days. Again, on 4/19, it was 17 new cases, but again, the previous day was 60 based upon return results. So the average per day for Hillsborough County, again, we saw this last week, is still roughly 34 a day. For Hillsborough County, I believe the chairman asked how many cases or how many individuals have been tested. Well, the total tests are 15,281 on the far right-hand side. Again, I can't account for individuals who may receive duplicate testing. But again, there's been an issuance of 15,281 tests reported through the Florida Department of Health record daily report that we get. As the bottom line of the light blue color, Dr. Holt and I were talking about, we want to see that line go up. The daily change rate indicates more testing, not flat or going down. But again, trying to go up consistently. But again, you can see the 3%, 1%, 8% on the bottom. Again, it deals with the labs returning the results in a timely manner.
So, Mr. Wagner.
Yes, sir.
Commissioner Miller, so we've tested about 1% of the county's population?
Next slide. Yes. Yes, exactly. Yep. And again, that is correct, Mr. Commissioner. We have 1.45 million individuals with 15,000 tests. Regarding duplicates, which I can't account for, comes out to be a little bit over 1% has been tested. So that's kind of where we stand through the 19th of April. We'll test about 1%. Of all those 15,000 tests, Hillsborough County has a 6% positive rate return results. Again, there may be more individuals who have been asymptomatic who haven't received tests, but this is based upon the return test results. 6% positive, 93% negative. The state of Florida, for comparison, as I said last week, was 10 to 11% positive on average. One of the new demographic reports that the other analysts produced, we asked the question, what is the percentage on total population? So what does that mean? The blue bar for females make up 51% of the total population in Hillsborough County. Females make up 50.4% of the COVID-19 cases. So statistically, they're essentially the same for male and female. So we were trying to ask the question, are more males getting it or more females getting it? Based upon the return results, we're statistically in the ballpark with our total population from a demographic standpoint, from a gender standpoint as well. This slide is the age breakdown by females, respectfully. Dr. Holt has continually said 65 and plus. The far 3 right columns generally are about 15% of the total cases. Again, our older population potentially. And again, we are seeing that for females. I think those numbers add up to a little bit about 15%. All the females from 25 to basically 64 have been pretty flatline. 25 to 34 make up a little bit higher percentage, but again, it's only a couple percentage points. But again, the cases of COVID-19 on the diagnosed results are pretty even throughout for females upon the age ranges. On the male side, it has more of the standard curve, which just happened to be the way the data came out. Again, on the far right 3 columns, 65 and plus, they are about 17% of the total cases are positive results, so it's slightly higher than the females. And again, on the middle-aged males from 35 to 44 and 45 to 54 are slightly higher, 19% and 18% exclusively by their age ranges, a more standard curve that we're seeing, but nothing statistically, large variance of age ranges. Ethnicity. So I'll start on the bottom because there was a lot of questions about Hispanic ethnicity. What is their infection rate? Well, currently, based upon the return results, 29.2% Hispanic ethnicity is in the county based upon census data. The results from the COVID-19 test are 29.3%. So again, from a Hispanic standpoint of known results, they're about the same from the FDOH data. Non-Hispanic, 70% is census data, 54% is the FDOH data. Again, there's that other column says unknown. The FDOH data has an unknown column, which makes up 16.9% data. Census does not. And I can assume that they are non-Hispanic, but I cannot for sure or without verification. So we left that in the unknown column. But I think the takeaway here is on the Hispanic side of ethnicity, based upon the prevalence of testing of the individuals who are tested, they're about the same from the diagnosis standpoint of positive results. Again, now we flip this over to race. On the Caucasian white side, 69% is the total population of Hillsborough County, according to census, 50% of positive cases. On the African American side, 16.8, 15.7 respectively of positive cases. Other is where we're seeing a little difference. That could be Asian, Pacific Islander, Native American, a little bit higher on positive cases versus the census data of 13.4%. And then the unknown category, which could be spread out between all 3 of those other categories, again, from FDOH is 13.5% are positive. Again, and the takeaway here, the other is a little bit higher, but luckily the African American positive cases are statistically the same or near each other. Hospitalizations, where this is ethnicity again, the Hispanic side is 32.7% positive hospitalizations according to the FDOH data versus 29% of the total population. So it's about 3% slightly above from a hospitalization rate on the Hispanic side. The non-Hispanic is less that we see from 70.8 to 61%. And the unknown again is 5%. So again, the trend for the takeaway is for me to continue to watch the Hispanic ethnicity report on this slide to see if that stays within statistical variance that's somewhat acceptable or if it grows. The last slide, I believe, of this deck is the hospitalizations by race. The white is 69% total population, 51% of the COVID hospitalizations. So that's very less. The African American is the takeaway for me to review and continue to monitor. 16.8% of the total population in Hillsborough County versus identified in FDOH of the positive results that are hospitalized, 26.5%. Again, that's one that we need to continue to monitor as I do these updates and other strategies. But again, these are the individuals who were tested positive and had a hospitalization. according to the FDOH record. Other, 19%, 13% from the positive versus total, and the unknown is a 2%. So again, the takeaway is to monitor the African American hospitalization data going forward based upon this, because we know there's prevalence of possible more chronic diseases in the minority population. And that's all I have. If there's no questions or any questions.
Thank you, Mr. Wagner. I see no questions. I might have one after I call on Mr. Dudley that you may need to answer. But I see no questions of it right now, Mr. Wagner. Thank you very much. Mr. Dudley, you recognize.
Good afternoon. Current status on our collection sites, we continue to support Raymond James Stadium. Last week, we had 915 collections executed. We have 362 appointments scheduled for this Tuesday. We are currently partnering with USF and DOH to open 3 new sites to extend testing and collection beyond Raymond James. By this Wednesday, teams will be in place at Lee Davis Community Center, South Shore Community Center, and Plant City Community Center. We have our current ETA on the rapid results COVID-19 antibody blood test. Within the next 4 weeks, hopefully we'll be able to see those arrive. We are also asking anybody that feels that they need to be tested, please contact us at 813-272-5900. Call center is open from 8 to 5, and we continue to vet. As of last week, we received another 1,000 kits from the state, and over the weekend, we received another 1,000, and we have a little bit over 4,000 kits that we're currently working with to support the sites at this time. And PPE currently meets the demands.
Okay. Thank you, Mr. Dudley. Let me ask a question. Maybe you, Mr. Dudley, and Mr. Wagner may need to answer. Mr. Wagner just showed his percentages when it came down to minorities. And as far as I can see, there could be some disproportionate numbers in there according to the population and those that are positive and those that are hospitalized with the numbers you showed. Where are we? We discussed last week mobile testing. Where are we on the mobile testing at this point?
As of this week, we should have that process solidified. We're completing a couple of administrative processes in the background, but we've partnered up with some private ambulance services to develop strike teams, and we'll begin scheduling individuals with transportation or homebound challenges. We should be able to execute that starting this week.
Okay, and I hope we can get that done this week, because I do believe, even though you saw those numbers, I think, well, the disproportionate. I think that once we get that mobile testing moving along, and we do move the testings, have some testing at the Lee Davis and other centers, you might see those numbers increase, and that disproportionate number will even get wider. I do believe that's going to happen. I think the more tests we do, the more results we're going to have positive and more people hospitalized. That's my thoughts. From what I'm looking at now, that might happen. So that's why I asked that question. Thank you very much. I see Commissioner Overman, you recognize.
Thank you to both Mr. Wagner and Mr. Dudley. Those are great information. 2 questions. Kevin Wagner, you brought up a slide that showed the age ranges and illustrated how they were interpreted. And is it possible you could bring up the one that showed the various different age ranges of the positive cases?
Sure.
And then I'll ask Mr. Dudley a question while you're doing that. Mr. Dudley, I'm curious. I didn't see in the last set of incidence reports the information on the number of tests taken each day. I see an increased number of kits available, but I'm not seeing what our daily test numbers look like. Is it possible you could give us that information on an ongoing basis?
Yes, we can. We can provide that as a part of the situation report.
Because the last 2 reports I looked at, there didn't appear to be a difference in the number of tests administered. So I was just wondering, did we not test on Thursday and Friday? So and that can cause some of that erratic reports on positive and negative. So if we were able to get that information along with all the wonderful other information you're providing in our EAP reports. That would be great, or IAP reports. So, Mr. Wagner, you made the case that there were about 13 or 14% of females over the age of 65, and I'm just rounding the numbers. It looks like 14 to 15%. That over the age of 65 that are the cases. But I think what's really important for us to stress to folks is that while it's 15% over 65, almost 19% are between the ages of 25 and 34. Uh-oh, screen disappeared. And then the next category, I think, is 18%. Those are the individuals that may have high blood pressure or the beginnings of it, or diabetes. And those two comorbidities are the leading indicators of hospitalization when they, it's from what I understand, for COVID-19. I think we need to make sure that we're helping people understand that, yes, our seniors are at risk, but those that are spreading it are younger ages because they tend to have a higher percentage of positive cases. Is that an accurate summation of what your chart shows? Because I can't see it anymore.
I apologize. I had to restart the screen. If you can, Commissioner, can you readdress your question? Because again, I had to restart.
Not a problem, not a problem. Okay, so in this chart, for example, there's about, it looks like 16%, 17% over the age of 65 that have positive cases, correct?
Correct.
Okay. However, when you consider there's 18%, more than all of the people over the age of 65 that have tested positive. And those are the folks that are between ages 25 and 34, that have children, that are our workforce, that are out and about going to the grocery stores. The highest percentage of cases are ages that have exhibited symptoms enough to actually test positive are in the lower age ranges, correct?
That is correct, based upon the positive results received, correct. Of the middle-aged 25 to 64 range individuals.
Okay, so while it may not kill them, they're spreading it to each other in that age range. And then it's consistent all the way up to age 64, about 16%, 16%, 16%. So that, that's when you lump all those folks together, and that's our workforce, our highest incidence of cases positive are actually in the workforce age range, correct?
That would be a fair assumption, in the workforce age range, correct, Commissioner.
Okay, so I just want to make sure it's very clear to the general public as well as to this policy committee. The people that are getting this and the people they're spreading it to are workforce age range at a higher rate than our seniors, especially when you look at also within the male. So I think it's important for us to recognize how we message who needs to get tested and why it's so important if we want to fight this spread. So thank you very, very much for the information. That was very helpful.
Thank you, Commissioner.
Commissioner Merrill, you recognize.
Thank you, and I'll make this quick. Dr. Holt, are you still on? Dr. Holt?
Oh, yes, ma'am. Sorry.
Let me just ask you. Everybody's talking about levels of testing. Obviously, we're at 1% of our population that's getting tested. How would we increase the testing? I know we've got the mobile unit. We're going out to 3 more places, but at what percentage of our population would you feel comfortable with the tested individuals as part of our economic recovery plan? Or have you thought of the recovery in that terms, percentage of population being tested?
Yes, ma'am. The Florida Department of Health is actually working, I guess, to give us local health officers some guidance in how to participate in these discussions that will be coming. And I know that's something that we are participating with as a group that includes our advisors from the College of Public Health and some others to have a better understanding. There is a number of suggestions that have been done by academic centers across the state or across the country as far as what is the rate, and it's kind of comes as much to the daily testing goals you want to try to drive to achieve that eventual percentage. So it's long-winded, but right now I do not have a number. I just know that, I'd like to have more than tests than what the actual number that I believe our current data shows. If you begin to assume, which I've talked about, is that if for positive results do reflect, all tests, negative and positive, that are reported back on today reflect how many tests were actually done 3 or 5 days ago. Once you reach steady state, then I'd like to see more than what we're doing now, because what I see right now looks to be around 400 or average a day, maybe 500, and I do believe we need more. Exact number, I think there isn't a present guideline, but I'm certainly thinking about it. I'm sorry for the long-winded answer.
No, it was very good. And I really do. I thank you and Kevin for all your information, because it's really giving us some really solid facts, especially as we start to talk about economic recovery. I would like to see more testing. I think 1% for a county that's still like number 5 in the number of cases that we have in the state. I would feel more comfortable before we opened up if we were testing more individuals. Thank you.
If we're talking about opening up, we've got to have more people tested. No doubt about that. No doubt. Mayor Castor, you recognize. Mayor Castor?
Thank you. Sorry, I'm getting off of mute. A couple of things. One, for Mr. Wagner, do we keep statistics on who is tested? Did I miss that? On, race, ethnicity, age, those, well, we do have age, but like we have the statistics for the African Americans who tested positive and Hispanic positive, but what's that ratio out of the total number of actual tests that are given, or is that just the positive results?
Mayor, that was just the positive results. The testing data based upon demographic, as Dr. Holt and I talked, is not readily available at the FDOH level. That may be at the labs or future conversation.
Okay. Is there any way that we can start that immediately with the questionnaire that individuals get when they're tested? Because I mean, that's pretty significant, because if we're testing very small populations in the minority community and they have that higher percentage of positive tests, that would be very helpful information.
I would defer that to Dr. Holt for an answer.
Okay. And then I also have a question, and I don't know if this is for Mr. Dudley, but on Friday, the information that we got was that we would, statewide, we would hit the level out with our deaths on May 6th. And then today it came out and it said we hit the plateau on April 2nd. Was that a typo, or does anybody have an idea?
Does anyone answer the mayor's question?
Dr. Holt?
Dr. Holt?
No, I would defer to which model. I think sounds like I do not know the model that we're talking about. I know that's been shared, or variety of different models have been shared
Yeah.
Across the thing, I thought, and Mr. Dudley, you've shared some with me, so I don't know which model. I apologize, ma'am.
That model.
That's okay. Just wondering, it just seems like on a Friday that it was a future forecast, and then by Monday it changed that we had already hit it. And so, and another thing too is
McCaster, can I say this? McCaster, the model that came out on Friday, I think, came from the University of Washington. The model that came out today came from another entity totally different from the University of Washington. So we got different models out there.
Okay.
Yeah.
I'll check that.
The model from Washington. The model from University of Washington said we would hit our peak May something. The one that came out today, which was a different group, said we hit it April 2nd. And I'm like, okay, that's a whole time apart. Who's right?
Yeah.
Yeah, it is scary.
That is a long difference. And Commissioner Merman and Dr. Holt, just for sort of a informational, Dr. Lockwood sent a email response out, and he projected that around 2,000 to 2,200 tests a day should be adequate for our area. Of course, that's his opinion. So that's it for me. Thank you.
Thank you. Mayor Lott, did I see your hand?
I did have it up. I took it back down. Mayor Castor asked the question I had. So thank you, Mayor.
Okay. Mayor Castor, you still have your hand up? Or you... Okay. All right. Okay. I think that that has all the questions for either Mr. Wagner, Mayor Lott, and I'm sorry, Mayor Lott, Dr. Holt, or Mr. Dudley. Thank you so very, very much. We now move into the economic recovery strategies, county stimulus funding to address COVID impacts to people and businesses. Mr. Merrill, you're recognized.
Thank you, Mr. Chair. Just wanted to give the group an update. The county has received $256 million in coronavirus aid relief through the CARES Act. I've provided the certifications to the Department of Treasury, and the money will be wired directly to the county. That funding will be able to leverage our rapid response recovery program that was described by Craig Richard, CEO of the EDC. And the funding can be used directly to assist residents who need to meet life needs, food, shelter, rent, and so forth, as well as businesses impacted by COVID-19. There are some criteria in spending the money. It can only be spent directly related to the COVID virus. It cannot be spent on things currently in the adopted budget, and it has to be incurred by the end of this year, by December 31st. But within those criteria, the funding will allow the county to provide direct support countywide, including in the cities, to qualify for qualifying residents for rent, food, utility payments, and as I mentioned, to help support the business recovery efforts that the EDC is putting together through their task force initiative. That, of course, is important in terms of job creation, but also to make safety modifications as we begin to open up for business. We will also encourage private matching funds and business partnerships to make that funding go longer, make it go further. And so the next step will be for us to make recommendations to the county commission on targeting where that money is spent. Again, human needs, business, job recovery, housing needs, and contracts for essential infrastructure to help stimulate job growth. So that was great news, and hopefully it's just the first of 2 or 3 more tranches of funding that we will get. There's another bill in play in Congress that would send us about $130 million more. It's currently still in Congress. In addition to that $256 million that I've just been describing, We've also allocated $15 million through our social services department to help fill this gap right now for people who have become unemployed, as well as some business needs. And so that's flowing through our normal channels as people apply for assistance. That's an additional boost to cover that gap while we're waiting for federal support. So with that, concludes my report.
Okay, Mr. Merrill, thank you very much. I see no questions. I'm sorry. Commissioner Merrill, you recognize.
Thank you, Mr. Chair. Real quick, Mr. Merrill, I know we talked about this earlier, but I feel very strongly that nonprofits are businesses, and I know that they're being included somewhat in the task force, but I hope in the economic recovery plan that they are given a great deal of support and encouragement because they really complete the fabric of our community, and they do so much to help our residents. This weekend I got to participate with Feeding Tampa Bay and could not believe the number of cars lined up to get food. So I just hope going forward that nonprofit agencies are considered a very important part of our economy.
Yes, they will be included as part of that discussion.
Thank you.
Mr. Chair, this is Chad Chronister.
Yes, Chair.
I apologize, my hand's not working, but I did have some concerns in regard to economic recovery strategies and the role the emergency policy group will be playing in regards to the economic recovery task force vetting or flowing their ideas through the emergency policy group. And I believe the members of this group should have a discussion in public about the dividing line between emergency policy and the policy making that comes through the regular channels of government like city councils and county commissions. We have never seen an emergency that has covered such a long period of time, and the effects of which will last long after we see fewer cases of this virus. To start that discussion, I want to say this group has and continues to save lives, but decisions going forward about economic recovery, long-term health planning, and what our new normal looks like are not emergency policies. The emergency policy group should have no authority over the long-term economic recovery options this community chooses. City councils, mayors, county commissioners were elected for that purpose. The emergency policy group makes decisions that are reviewed and implemented a week at a time. But unemployment help, supporting small businesses, nonprofits, and prioritizing how we invest tax dollars in programs will have impacts far beyond our 7 days. Even if we renew our decisions every 7 days for the foreseeable future, we are dangerously close to interrupting the new normal methods for government decision making. There is a role for this group to make emergency decisions during a health crisis, but we need to make sure we limit ourselves to that role instead of deciding the economic future of our community.
Okay, thank you, Governor, geez. Appreciate it very, very much. Thank you for those comments. Commissioner Overman, you're recognized.
Thank you, Chair. And I do appreciate everybody's comments and questions. I think it's an important piece of this process. You know, we are deciding as an emergency policy group how to promote and preserve the public's health. And the reason we have this is we've got a health emergency, and we're trying to put things into place to allow people to stay safe and able to care for themselves and be whole human beings. And granted, not working is making it very difficult for a lot of folks. But what I wanted to ask about is in our policies, we recognize we've gotten funding for food and to help with rent and with utilities. And utilities has been traditionally limited to electric utilities. We need people's power to be on. But given that our schools and our teachers' ability to actually teach our children until we're able to open schools. That our businesses are being asked to have their workers work from home as much as possible. That our information dissemination about this emergency and how we communicate with people is largely over the internet. And our business recovery is going to be dependent on basically making sure that we find a new way to work together where the 6-foot distance still applies for longer periods of time, that we investigate ways that we can actually enhance our internet infrastructure. Right now, we have students that don't have access to internet. We have teachers that historically have used their mobile phones to get to internet that they're not able to use for their online teaching. We have communities that do not have access to hotspots. And we have businesses that are struggling trying to modify their business and their workforce to allow those that could work at home to work at home. So I'd like for either whether it's at the county level or the task force level, the EOC level, to investigate ways that we can explore ways that we create a robust internet service support system for our citizens that are dependent on internet service for all of the items that I mentioned: school, work at home, information dissemination, as well as facilitating a business recovery. And I don't know whether that's under the EOC or whether it's under the county, but given that we have a working relationship with our internet providers through Frontier and Charter, putting some effort behind that, I think, would be very valuable to helping us get back on track.
Mr. Merrill, you're recognized. Mr. Merrill, you're recognized.
Yes, in the last 2 EPG meetings, we reported out that we didn't make contact with Charter and Frontier. We got letters from them making a commitment to the community, those who needed to have internet capacity installed. And so that's already on the record. They've made their commitment. We work with them. There's also recently in the last week, I believe, I don't know if it was a presidential order or exactly executive order, which requires all internet communication companies to do exactly what you just described and to provide service for everyone for all the reasons that you mentioned. So I believe that we have covered that. We will continue to make sure that Frontier and Charter live up to their obligations, but now it is a federal mandate on all internet providers to ensure that all their customers get service.
Mayor Lott, I'm sorry. Mayor Lott, you recognize.
Thank you. First of all, I want to thank Commissioner Overman. She's been pounding this gavel every single meeting about the internet, the services we provide for, and I hope you keep on pounding it until we have every citizen taken care of, Commissioner. Second of all, I want to thank the sheriff for his bold leadership that he just represented just a while ago. I think that whether it's exactly the way he laid it out or not, I want to thank you for opening the door and just discussing how's the best way to lead this economic redevelopment of our community. You're right. From Plant City to Tampa Terrace to Tampa and our unincorporated area, we have a lot of uniquenesses throughout our county. And what we don't want to do is, with our intent to do well, actually slow down the process. So, Sheriff, just thank you for opening that dialogue, and I hope we have a lot more dialogue on that regard. Appreciate it.
Mayor Castro, you recognize.
Thank you. Thank you. I agree as well. I do think that we should, with $256 million as a group, we should decide where all of that goes. With that, there's others that should again. But with that said, I also think that we should look at those immediate needs, food and shelter. Those are the things that our citizens need. I too was at one of the Feeding Tampa Bay, and the sheer number of cars in line was heartbreaking. And there was no doubt that there were people that were in line, but this virus would be volunteering to hand that food out. And so people, we all know that, we've all heard it, are hurting in a real way right now. And so one of the things that I would suggest as far as food relief goes is to include some of our restaurants in the city in that production of food and that distribution of food to individuals that need it in our particular areas of responsibility. I think that would be a wonderful use of some of the funding. And then I'll talk when we're done with this discussion about our initiative here in the city. Thank you.
Okay. Commissioner Overman, you recognize. Okay. Mr. Merrill, you have something else, Mr. Merrill?
Yeah, I'm sorry if I led the EPG to believe that I was asking for the EPG to take up to $256 million. I was just simply reporting out to the group because the group has expressed, you've all expressed an interest in the past in hearing about different initiatives, whether it's social services, whether it's food, whether it's economic recovery. And that's the reason I brought Craig Richard. So it was really more just to help you get a more complete picture of what's going on. I mean, clearly, in this case, the funding from the federal government's coming to the Board of County Commissioners. And we will, and I'm sure they will take a community-wide approach to how it gets spent. But if I left you with the impression that I was asking you all to deal with that, I was not, and so I apologize.
Thank you, Mr. Merrill. Okay, Mayor Castor, update on the City of Tampa's One Tampa Relief Now Rise Together initiative.
Okay, speaking of immediate needs of food and shelter, what we're trying to do for the citizens inside the City of Tampa is to provide assistance, immediate assistance with 1 month's rent and or mortgage and utilities. And it's two-pronged. It's for individuals who have lost their jobs or had their pay decreased dramatically because of the virus. And then the second is for small businesses that are located in a low-income tract or a CRA, which covers a large swath of our community, but in those two particular areas. And so we had a web page out that had all of the details and the qualifying criteria. And I don't know if it's positive or very sad that we went live at noon on Friday and we had approximately 10,000 calls that day, or applications or inquiries. And so we are, with the funding that we have, our goal is aspirational. We have money from HUD and CDBG that we can apply to the mortgage, rent, and utility relief. We also have CRA. We're hoping to get the interest on CRA funding that would be in the ballpark of $2 million, as would the HUD grant. And then we are looking to match up to $2 million from our emergency fund, usually used for hurricanes, any donations that we may get. And we've had some very positive responses so far in donations. We had all of the sports teams step forward, Lightning, Bucks, and Rays. Joe Williams from Kimmons stepped forward. They all donated $100,000. And we've had a number of others that have donated. We've had a lot of people that received a stimulus check, but had not been negatively impacted by the virus. And a lot of those citizens are donating those checks as well. So again, aspirational goal of 8 million, which would serve approximately between 2,000 and 2,500 citizens and 800 businesses. Very small number when you consider the need. Again, doing what we can to help out the citizens here in the City of Tampa. And that's it, sir.
Thank you, Mayor. Mr. Merrill, did I see your hand? Mr. Merrill?
Sorry about that. I forgot to switch
Okay.
it on.
All right. Very good. Okay, Mayor. Thank you very much. I don't see any questions, Mayor. Thank you for that update. We appreciate it very, very much. Mr. Harness, County Social Services update.
Good afternoon, Mr. Chair, honorable members of the EPG. Carl Harness, Chief Human Services Administrator. I'll provide you with a brief update of the Social Services Department's efforts.
Mr. Harness, you'll have to speak up a little bit.
I'll provide you with a brief update to the efforts of the Social Services Department. Can you hear me now, sir?
Yes, go ahead.
Okay. Access to additional funding up to $15 million has been made available to Hillsborough County Social Services Department in response to requests for services more than doubling since the beginning of this pandemic. In addition to the funding, capacity to serve residents will also be expanded, utilizing community partners such as Metropolitan Ministries and staff from the county's Library Services Department being cross-trained for as eligibility specialists. Going to Commissioner Merman's earlier point, we are in the process of finalizing an agreement with Metropolitan Ministries in order to increase the capacity of households being served and households in need being served, as well as we also anticipate obtaining a proposal from the Children's Services Board to develop an agreement to continue to increase the capacity to serve more households in need. We are also finalizing training and the new call center details to implement the increased capacity to serve, utilizing staff, county staff, and to serve more households, as I had said before. Effective on Monday, April 27th, residents will be able to be pre-screened for eligibility by contacting the newly developed COVID-19 Rapid Response Call Center at 813-274-3710. Eligible households impacted by the COVID-19 pandemic with a loss of wage will be assisted with up to 2 months of past due shelter payments and 1 month of utility bill assistance. In the department, we continue to work expeditiously to make these services accessible and available in anticipation of evictions and utility count disconnect orders resuming due to non-payments in the coming weeks. Another new initiative that we're looking into in terms of trying to develop options, we're having discussions with our partners on how best to address residents who reside in hotels and motels and pay a weekly or monthly rate that have experienced a loss of wage due to COVID-19, but do not have a lease agreement to protect them from facing an eviction or non-payment. So we are looking at that. And we are also scheduled to participate in a teletown hall meeting tomorrow to discuss and address the needs of USF students that are impacted by this crisis. Mr. Chair, myself and Audrey Ziegler on the line for any questions that we may need to address, and that is my report.
Thank you, Mr. Harness. And
Just one question.
hold up. Trying to see if I can get this thing to work now. I don't know what's going on. All right, Commissioner Merman, you recognize.
Real quick, Carl and Audrey, is that number, the 274-3710, will that go into the customer call center? Is that the number we give out to the listening public so they know? Because I think the number they call about getting tested is different than this number. Is that correct?
Yes, ma'am. This is a specific number, especially for this project.
Okay.
So yes, ma'am.
Okay. Thank you.
Okay. Mr. Harness, Ms. Ziegler, thank you very much. Appreciate it.
And Mr. Chair?
Yes.
Mr. Chair, I just like to, a lot of people have helped with this endeavor, and I'd just like to thank Bonnie Wise, Scott Stromer with procurement, Tom Fessler, County Attorney's Office, in assisting us with trying to get all these agreements and things done in an expeditious manner.
Thank you. And thanks to all those he just named to get this done. Thank you very much. Thank you. We're now moving to public engagement strategies, update on USF COVID-19 survey. Dr. Unnasch, you recognize.
Can you hear me now?
Yes, sir.
Technology, So yeah, is there a way of sharing my screen? I'd just like to sort of show you. Let me see if I can do this here.
Okay.
No, that didn't do it. Can anyone see the screen that I have here now?
Yes, sir.
Okay, so what I'm going to show you here are the two screens. This is actually the survey that we've put up to try and look for symptoms. You remember when we talked about this last week, we had developed this survey to try and look for symptoms that were consistent with a COVID-19 infection to try and assist the county in augmenting what they were doing vis-a-vis the testing systems that we have. We figured there's a lot of people out there who really have the symptoms who are either not eligible for testing or haven't been able to get tested. And to try and help fill this gap, we're trying to develop this syndromic surveillance network where people can go in and fill out this survey if they actually have symptoms that they think may be consistent with a COVID-19 infection. And then we're collecting that data and automatically putting it into a dashboard. So this is the survey that we have out there now. It's a very simple survey. It's only 3 pages long. Let's see if it'll actually work. I don't know if it'll. No, well, it doesn't. Yeah, actually, it does. So socio-demographic information, zip code. You can select Hillsborough County or Pinellas County. Those are the 2 counties that are currently doing this. You can just pull down your own zip code. Here, you can indicate your ethnic group, and then if you have any of the symptoms that or coexisting morbidities that may increase you at risk for hospitalization, they're shown here. You can continue on downward. How many people live in your houses? Do you smoke, or including vaping? Next, your age and your sex. Again, your count. This has actually gone back to the same thing before. But we continue on, and then the next page after this will, which is not going on, to go the other page. I'm sorry with that on the sharing. But then it will ask for the symptoms, and then it has a listing of resources. And all of this data is now rolling into our background dashboard that's here, which is here. And this is actually showing you some of the results from the surveys that are here. What you can see here is you could actually choose the zip code that you're interested in. I chose 33647, which happens to be my own zip code. You can see there are 16 people in our zip code have filled out the survey so far. It shows down on the bottom here a bar graph of pre-existing comorbidities in this group and what the symptomologies were along the way. And we can actually go ahead and develop heat maps. Once we get more data, you can see the number of surveys that have been filled out so far is fairly small for zip codes. Which will allow us to develop heat maps by zip code for the county and also for Pinellas County. That will allow us to go ahead and identify zip codes where there are large numbers of people who are filling out the survey who actually have symptoms that are consistent with the COVID-19 infection. And you can choose, as I said, any zip code that you want up there, or you can actually choose just all of the zip codes together, and it will give you a summary of the entire what's going on across the entire county, a number of surveys filled out in Hillsborough versus Pinellas. So this is out there now. This is working. I want to be able to share the link here with anybody who wants to look at it from the county. And as I had mentioned in my previous talk that I gave last week, I am not much of a marketer. And so what I'd really like now is some ideas from the county and ways that we can actually go ahead and get the word out on this, to get people to go here and start to go ahead and fill out these surveys for us. Because the more data that we have, the better it will be. One of the other things that I think we're going to be able to do is actually download the data from this survey here and combine it with data, if we can get data from the hospitals and from the counties in terms of the call-in centers that they're getting with people who are reporting symptoms. So we may be able to augment this voluntary system with data that's coming into the call centers as well, and give them more comprehensive idea of where people actually think they're having developing symptoms. I think this is going to be fairly useful now, but I think it's going to be much more useful as an early warning system moving forward when we actually start to think that the first wave is over and we start to open up again. We've heard a lot today about contact tracing and testing. I think one way of actually augmenting this is actually going to be allowing you to use a syndromic survey type system here to really identify potential zip codes where there may be symptoms or large numbers of people who are reporting in symptoms. So that will allow us to target, using these mobile units, the testing into those areas where we think there actually may be a problem, and deploy our testing and our contact tracing into zip codes where people are reporting the symptoms and therefore are likely to really have a problem. So that's where things stand at the moment, commissioners, and well, I'm open for any questions.
Dr. Unnasch, thank you very much. I don't see any questions at this time, but what I'm going to do, I'm going to call on Ms. Liana Lopez, who's going to bring an update on the community survey of attitudes concerning the COVID testing. And Ms. Lopez, if you don't mind, could you possibly address Dr. Unnasch's question on marketing his survey, if at all possible? So Ms. Lopez, you're recognized.
Yes, good afternoon. I'm Liana Lopez, Chief Communications Administrator for Hillsborough County. Thank you, members of the EPG, for allowing me to provide a brief update on the reporting approach for the preliminary data collected from the Community Engagement Survey related to the attitudes concerning testing of COVID-19. As a reminder, the telephonic survey launched on Friday, April 16th. We're expected to have a full week's worth of data collected at the conclusion of the day, Thursday, April 23rd. HCP Associates, our research partner, will review that data and provide a weekly reporting to the county. We plan to submit these written reports reflective of preliminary data to the EPG. The companion online and SMS text versions of the Community Attitude Survey are scheduled to launch this Wednesday, April 22nd. The preliminary data from the online and text versions will be added to the weekly written report submitted by HCP and will also be provided to the EPG. In addition to this data delivery schedule, HCP Associates and the county are available to appear before the EPG to share findings with a recommendation of every 2 to 3 weeks to ensure relevant preliminary data is highlighted. At this time, I would also like to provide a quick update regarding communications and outreach efforts in support of the University of South Florida's modeling project led by Dr. Unnasch. University Communications actually disseminated the official news release just this morning. Following that effort, we briefed the Joint Information Center partners and requested today that all partners support messaging through their platforms and channels. Information from USF's news release, including the link to the survey, will be included in an upcoming JIC release today, and the county will support and engage from all of our platforms as well, including all of our social platforms. Finally, the county's analytics and insights analyst, Terry Cordova-Hewitt, is working with Dr. Unnasch to be able to provide his team with an SMS text survey option as well. We expect that will be available for his team and the public later this week. This concludes my update, but I am available for questions.
Thank you, Ms. Lopez. I see no questions. Dr. Unnasch, did you understand what Ms. Lopez said?
Oh, absolutely. And I'd just like to really thank you very much, Leah, for what you've done. And I think this is going to be very, very useful. And I'm really looking forward to getting the phone survey. I think that could be really useful as well. And I very much appreciate you helping us get the word out.
Absolutely.
Okay.
Commissioner Miller?
Hold on, Mr. Mayor Ross. I saw Ms. Overman's hands first, so let me recognize her. Ms. Overman, you're recognized. Commissioner Overman, you're recognized.
Thank you, sir. Okay. I really appreciate it. Thank you, Dr. Unnasch and Liana. Those are great reports. And I think we have an opportunity to make sure we're catching everyone that's in need, too. Sending this information out is one way, but when people are calling in, for example, the mayor mentioned 10,000 calls on Friday. Social Services has had a significant number of calls into it since we've gotten started on this. And we have our testing center that takes incoming calls regarding wanting to get tested or learn how to get tested, and they're getting information. Is it possible that in all those cases, we have an email address when we take that information for those incoming calls, and we can automatically send them our survey and the link to Dr. Unnasch's survey in order to act as a follow-up to those calls? Because people are calling in. We've gotten, what sounds like 20,000 calls over the last several weeks. But if we don't get that kind of response in our outreach, we may be missing an opportunity to take advantage of that touch point. So is that part of our strategy, and is that what's rolling out on Wednesday? Thank you very much.
It could be, sorry, I apologize. So it could be, we're looking at the feasibility. Related to the call center, we recognized pretty quickly when we were doing the testing site that a lot of people in our community didn't have access even to email. And so if they've given an email address or anything like that, we can look at that going forward. Absolutely, we'll look at the feasibility of that. But I want you to recognize that with the testing site, we did have that issue. And so I don't know if at the beginning we had said you did not need, you had to print a confirmation. That quickly had to change, access to printers, even access to email, and we were just voicing the code over the phone. Some do still receive an email, so we can definitely look into that.
Mayor Ross,
So we could use the SMS system in that particular case, correct?
Yes, correct. That's why the SMS system will be so vital.
Mayor Ross, you're recognized.
Thank you, Commissioner. I had a question for Dr. Unnasch. Great presentation. Thank you. I really glad that you put that survey up so that we could take a look at it. My question is, what happens, if does anything happen, if somebody goes into the survey and answers all the questions positively so that they are displaying signs of, if not COVID-19, at least some serious flu or illness? Is there any contact with these folks, or are they automatically referred to the other hotline for testing, or is there, or it's just a standalone survey?
Right now, it's just a standalone survey, sir. We had spoken about this last week to some of the people in the county health departments, and we're planning to set up a referral center for those individuals who actually may show that they had large numbers of the symptoms that were consistent, to forward them off to some of the USF medical students to talk to them, and then go ahead and then refer them to hospitals or an urgent care center to get them tested immediately if they look like they were in serious trouble. But the county health departments were a little nervous about having medical students providing that sort of advice. So although we had things pretty well lined up for that, we had to pull that at the last second. If there is a way of doing this and providing a referral through the county to the county health line, I would be very happy to investigate that, because I'd like to provide some sort of incentive or something to the people who do fill out the surveys to allow them to, get something in return, especially if they're really sick. I think it's important to figure out a way of doing that. We just haven't figured out how to do that yet.
Okay, good. Well, I had the reason I asked that question is...
Excuse me, Mayor Ross still has the floor. Go ahead, Mayor Ross.
Thank you, Mr. Commissioner. The reason I asked that question is to ask this one. Is there any concern or is there a comfort level that these people that may have, if not COVID-19, they've got something, is there any concern that these people who are sick, right, they're probably not thinking as clearly as they might normally, would complete this survey thinking that they're reaching out to be triaged for testing or something, realizing that they need to go somewhere else? Is there any concern that people go on and complete the survey and then for somebody to clear them for testing, thinking that they've reached out for help, or is there a safeguard in place to prevent that from happening?
We mentioned that in that long introductory paragraph, but it's probably something we really need to put in bold or bold text or something like that, so it's actually really clear. And as I said before, I'd really like to set up some sort of a mechanism where we could actually reach out to people who were really sick and let them know that they can have a place to go to contact someone else. In this way, it's somewhat similar to what's going on with the like some of the CDC surveys. You don't get any. You put in your information and it tells you, yep, you're likely or not likely, and that's as far as it goes. But I think in our community we should we should try and figure out a way maybe of providing something more, if we can.
Okay. Well, that's my only concern, is that these people are, technology can be confusing enough, but then when you're sick, it's even more confusing, and you think you've reached out for help and help never arrives.
Nobody's really rational when you're running a big fever, especially if you're thinking you have a disease that's getting as much attention as this one is.
Okay, I heard someone else's voice, but I don't see the hands. Was that you, Chef Cronister?
No, sir, but
I think it was Dr. Holt.
Was it Dr. Holt?
Yes, sir. I apologize. When we and I don't want to get too much in the details, but I think maybe we could present on Thursday. If I could work with Dr. Unnasch, I think I can provide a better more complete understanding of what the health department looked at for this intentions, and but more importantly, the considerations of any medical consultation that this would be linked to. I have no objections to using medical students. Just to be clear, I just was concerned the university would, but we can certainly discuss that and come back on Thursday.
That would be great, Dr. Holt. I'd really appreciate doing that because, like I said, it was my understanding that people were very uncomfortable with medical students giving medical advice, though this is being done in other places. But I think we could get medical students involved if people are comfortable doing so. That's the major thing. I don't think we're actually looking for people to do anything much more than what some of the websites do now, which is basically say, it looks like you have a good combination of symptoms. You probably need to contact a testing facility to get tested, and leaving it at that. And that's done automatically on some of these, like the Baycare site, for example, does something similar to that. But yeah, I'd appreciate talking to you about this, Dr. Holt, to try and work something out. I think we could really, like I said, I'd like to give the people some sort of incentive or return on actually filling out the surveys. I think ethically it's a good thing to do.
Okay, thank you very much. Whether we realize it or not, hurricane season is right around the corner and right in the middle of a pandemic that we're addressing. So we're going to have an update on the emergency management preparation for hurricane season from the Emergency Management Director, Mr. Dudley.
Good afternoon again. Yes, sir. The hurricane season presents its own challenges as well as what we're dealing with the pandemic. But we begin working towards and beginning our planning assumption. 2020 hurricane season is predicted to be a busy one, up to 40% above average. We're working with All Hands Consulting. They're working to update our current plans for this year based on the pandemic. They're working with us to complete several new plans that were developed over the past year and to supplement existing plans with pandemic considerations. We're working with communications and digital media to finalize our annual disaster preparedness guide and to craft messaging to various stakeholders, groups, and public officials as well. The All Hands team has been contracted to provide additional command and general staff to help manage the EOC during a hurricane response while pandemic operations continue. While a hurricane would adversely impact all local operations, including the pandemic response, plans will be based on the assumption that we will continue to support pandemic operations and under a unified command approach. We are working to develop sheltering alternatives based on social distancing objectives, several options based on various levels of storm severity have been identified that we will review with Department of Health officials. For example, we may open all shelters for a limited evacuation so as to provide greater square footage per person. We're also looking at additional facilities that may be available for shelters or refuge of last resort. We may experience staff shortages and lack of mutual aid resources will be constraining factors to consider during our planning process. Personal protection will be consideration in all aspects of the response and service delivery. The pandemic has provided the Office of Emergency Management and our partners with an opportunity to test, develop many new processes and tools, while at the same time getting extensive experience with a prolonged EOC activation. This will help make a hurricane or other response run more efficient. So with that being said, we've been, the EOC has been activated for over a month now. The team's been working efficiently and effectively to respond to this. And we've taken every opportunity to review our plans, our process and procedures, Our comprehensive emergency plan for the county is an all hazards plan, and it enables us to adapt to any and all hazards. This concludes my update. I'll take any questions.
Mr. Dudley, thank you very much. I see no questions at this time. Let me make sure. No, I don't. Thank you for that update. We appreciate it very much. Thank you.
Yes, sir.
Federal and state legislation updates. Mr. Wagner, Brandon Wagner.
Thank you, Mr. Chairman and members. My name is Brandon Wagner, Chief Government Relations and Strategic Services Administrator for the county. I'll start at the federal executive and agency level. As we've discussed before, we continue to await guidance from Treasury on how we can spend the $150 billion local, state, and federal tribal relief funds that were provided in the CARES Act. That was earlier referenced by the county administrator, who indicated that we have submitted the certifications necessary for the direct funding component to the county. This is the next step in understanding how those funds are specifically expended and reported. And as soon as that information is released, we will forward it on to you at the EPG level. Last Thursday, FEMA released its disaster financial management guide that will support jurisdictions in establishing and implementing financial management practices in light of disasters, both health and weather related. They also indicated the availability of their emergency management performance grant program. It assists locals with public health and emergency management activities. Applications are due 1 day prior to the deadline of April 28th, which is quickly approaching. So those who are interested should go to the FEMA website and look into the application information. Early applications will be reviewed to determine eligibility and allow them to complete their submission in a timely and complete basis. In addition, the Environmental Protection Agency has announced its coronavirus resources to allow local, state, and tribal agencies to continue to do environmental protection without interruption during the coronavirus emergency. Next, as you are all aware, as was briefly highlighted earlier in the call, the administration announced its Opening Up America Again phased approach for states to begin re-energizing their economies. I won't go through all the details, but if you are interested in them, I am happy to forward those to you. In summation, the processes will be handled locally by the governors of each respective state, and they are also permitted to work regionally. The information also provides core preparedness responsibilities, which includes adequate testing and screening, the need to supply sufficient protective gear and medical equipment, et cetera. Moving on to recent congressional activity, the county administrator also touched on this. The Paycheck Protection Act funding has been exhausted as of last week. There has been and continues to be a strong desire to pass another supplemental appropriations package to replenish that fund. Indications are they could take action as soon as this week. The latest information that we have is that there are two proposals in play, one in the Senate and one in the House. At the moment, it appears that the Senate version is what may prevail. The Senate proposal would be a $470 billion package. It would provide $310 billion for the Paycheck Protection Program. That's $250 billion for the program and $60 billion for smaller banks to aid in accessing those funds by small businesses. $60 billion for the Economic Injury Disaster Loan Program, and $75 billion for hospitals and $25 billion for testing. The Senate version does not currently include funding for local, state, and federal governments. Both the Senate leadership and the White House has indicated they're deferring those discussions to a future bill. The bill that was referenced earlier and that is still in play is a bill coming out of the House. It would allocate $29.5 billion for cities and a separate $29.5 billion for counties. 70% of those funds would be allocated by the CDBG formula. 30% would go to the state. The distinction in this bill is that the funding is for COVID-related expenditures, but it would also allow local and state governments to address budget gaps that result from the emergency. That's a flexibility that was not provided for in the CARES Act. Again, our understanding is at the moment, the Senate bill seems to be in the advantaged position, and this may be part of a future discussion. Another bill that was recently highlighted was a bipartisan bill coming out of the Senate creating a $500 billion fund that would go to local and state governments to address budget impacts. It would also be based on a formula, but it would be based upon a combination of population, infection rates, and state revenue losses, and guarantees that no state receives less than $2.5 billion and would give direct funding to counties and cities with populations of 50,000 or more at lower threshold than the CARES Act, which had a floor of 500,000. Again, the process is fluid. We don't know what packages will ultimately end up passing until they're actually at the floor and in motion, but that's the latest information we have at the federal legislative level. Turning to the state, the governor issued a new executive order on Thursday, temporarily suspending the biweekly reporting requirements for those receiving unemployment compensation. The governor also moved oversight of the unemployment response during COVID-19 from Department of Economic Opportunity to the Florida Department of Management Services. And on a note earlier mentioned about reopening the country, the governor is set to convene a Reopen Florida task force. That meeting was expected to be convened as early as this afternoon. We don't have full details at the moment about who's all on there, but when that's available, we will also forward that to you. Mr. Chairman and members, with that, I conclude my report, and I'm happy to take any questions.
Thank you, Mr. Wagner, and I see no questions at this time. We appreciate your report, very detailed. Thank you so very much. We'll now move into EPG discussions. Are there any issues or items we need to discuss today from the members? Any Commissioner Merrill, you recognize.
Thank you. Great information today, and I appreciate all the effort and all the man hours it takes into putting together this information so we can make decisions based on data. I am really looking forward to Thursday's meeting, and so that we can start the process like we mentioned. It has been mentioned by several individuals earlier, so we can start talking about the process of opening our economy back up while being safe at the same time. So I'm really looking forward to Thursday's meeting, and I hope that we get the information and what's being proposed and so forth as at our earliest date possible, so we have enough time so that we can review it and be prepared to have that discussion on Thursday. So thank you very much.
Thank you, Mayor Mayor Castor, you recognize.
Thank you. I would make basically a shameless plea for some of that disaster recovery funding to come to our One Tampa program. I see that where there was 15 million put into the county's similar program. And a third, although on our application website, there's actually a link where you can type in your address and it tells you whether you're in the city or the county. A third of the individuals that applied were actually in the county and not in the city. So we had to cut ours off, 2,500 individuals, over 10,000 applications, and we anticipated we would have the line open for a week. We had it open for less than 2 days, actually less than a day and a half, and we had already gone way past our capacity. And we haven't opened up for small businesses, but all we would be able to help would be 800 in a very specific geographic area and specific types of businesses as well. So we would appreciate some assistance with that program. Thank you.
Thank you. Commissioner Merrill, you recognize.
Thank you, Mr. This may be for county attorney.
Can't understand it, Commissioner Merrill. Go ahead. We can't hear you, Commissioner Merrill.
You there?
Yeah, okay, go ahead. Now we can hear you.
Our economic recovery plan is totally dependent on our governor opening up the state. Is that not correct? Because we can have the best intentions, but we just can't unilaterally open up our county because we would be going weaker than what is in the governor's order until he makes that decision. Is that correct?
do we have Ms. Christine Beck on the line?
Yes, Commissioner. I understand your question, Commissioner Merman, and I think we'd have to look at exactly what kind of things you're talking about to make sure that we remain consistent with the governor. But at the same time, there is some latitude there. So perhaps as we're preparing for future meetings, we can work closely with staff to make sure that we're on the same page.
Like, what kind of latitude do we have?
Well, we have to be consistent and we can't be in conflict, but, there has definitely been latitude given in some areas. So the main thing is to make sure we're not in conflict with any of the state orders, of which there are over 100 at this point.
Right, that's correct. And I know the city has a beach. I guess we have one beach. I don't know if that would be included, but anyway, I guess we would just need to have a report from you exactly what that covers and doesn't. Because I'm afraid we just can't tell businesses they can reopen because that would conflict with this order. Is that right?
We can't, that was clear with regard to the non-essential businesses. And frankly, with regard to the essential services and activities. But for example, based on those FAQs, there was specific latitude given to do such things as opening up beaches and a few other examples. So it really does need to be a carefully examined issue.
Thank you.
Commissioner Overman, you recognize.
Thank you. I'll make this quick. So here's what I think is important to realize. If we decided that it is our role to be able to relax some of the rules, I think it's going to be very important to realize how many people are going to be in a very tough decision when they're too scared to go to work. I mean, what happens if we relax the rules and it means that they have to go back to work based on their employer or their industry, and they don't have daycare, they can't afford daycare, they don't have school for their kids to go to, and are they going to lose their job permanently because they won't show up because they don't believe we've tested enough people to allow them to go to work safely? I think it's important that we think about these things before we get too far down the line talking about opening up the economy. It was very clear in the report that we got last week about the 6 metrics that we had to meet before we even entertained any of those items. And I strongly recommend every single group member read the coronavirus pandemic whole of America response that was released on Saturday, April 18th. Thank you.
Thank you. Ms. Snively, you recognize.
Thank you, Chair Miller. So am I safe to assume that on the agenda on Thursday, there will be an item that will update us on the task force meeting that takes place tomorrow with the governor, and also that Ms. Beck or her department would be able to give us some of those examples of latitudes that she mentioned in her comments. And then with regard to Commissioner Overman's mention of the 6 metrics, where are we on that list of metrics? How do we compare? Where do we rank on those metrics in Hillsborough County? And perhaps we can have some of these conversations, some of these reports available to us, and some of these conversations on Thursday. If we could put those on the agenda, I would appreciate that. Thank you.
I do believe, I do believe in the conversation with Mr. Merrill, he's going to bring those issues up on the agenda.
Thank you. I just wanted to make sure we were clear on that.
Yes, we're going to bring those up on the agenda on Thursday in a conversation with Mr. Merrill. So we will bring those up on Thursday, and by that time, maybe we'll hear what's coming out of the governor's office, concerning his task force and where we stand on this whole issue. But be ever mindful, folks. We have only tested 1% of this county's population. 1. And I do believe that if we're going to open this county back up, we're going to go through a process, maybe come out the governor's office, we're going to have to test more people. We've got to. Commissioner Merrill, your hand's still up.
Yes, I just want to clarify because those 6 metrics, the president also said, and I remember that the decision is left solely up to the governor on how we reopen, how we apply the metrics, et cetera. So, the 6 metrics are great, but it's still going to be up to the governor, no matter what.
Okay, Mayor Castor, I see your hand. Mayor Castor?
I'm good. I forgot to pull it down.
Okay. Okay. I see no hands. Mr. Merrill, is there anything you want to bring forth, sir?
No, we're done.
Okay. With that being said, we will be back together on Thursday at 1 p.m. Everyone stay safe. Have a good evening. We adjourn.
Thank you. Thank you.
Thank you.